Well, Rita, this mode that we're going to talk about today is one that I do go into when I'm going to the dentist and possibly other times. But when I'm going to the dentist, I'm stressed. I'm worried about the fear. I don't show that. What I show is irritation. So when they say to me, "How are you going today?" I say, "Not good." And I start to get irritable. This is known as the angry protector in schema therapy. I'm Ruth Holt.
And I'm Rita Younan. We are both Advanced Schema Therapist Supervisor Trainers, and this is our mode model series. Now, an angry protector is an interesting coping mode, isn't it, Ruth? Because a lot of people are quite surprised in some ways that it's actually an avoidant coping mode. It's not an overcompensatory coping mode. It's not an angry child or emotionally charged, but it's an avoidant coping mode. So in some ways, I like to look at it as a wall of anger. So what could potentially be behind the wall of anger, Ruth?
Well, in my case, fear, but hurt, pain. People who've experienced abandonment, people who've experienced a lot of distress in relationships have often learnt that if I share that vulnerability, it's not going to get heard. I might get criticized. I might get shamed for that. So what I'm going to do instead is look fine, maybe be irritable, push you away. And it's a controlling kind of anger. So it's not an out of control anger. It's kind of got a sense of control in it. But at the same time, you can often feel there's something behind the anger.
Exactly. And I guess that's the thing, isn't it? What you find with an angry protector mode is that there's this curiosity around what's behind that. You find yourself kind of being curious that there's more to the story, if you like. And I guess there's different ways in how it might manifest. It might be irritability, could be sarcasm, hostility, humor with a touch of anger, if you like. And so all of these are kind of manifestations, aren't they, of a wall, and there being something behind that.
Yeah. And I think a lot of men in our culture have been encouraged to not express emotion, so they'll often maybe go to an angry kind of or cynical, sarcastic approach when they're asked about their feelings. And the thing with the angry protector mode, therefore, is it doesn't get your needs met. Because instead of, the dentist, for example, knowing that I'm fearful and reassuring me, what they do is kind of think, "Oh, grumpy patient," and they back away. And this is one of the challenging things about angry protector is it kind of reinforces the fear or distress that's underneath. So I never really learn that people are safe. I never really get a chance to be heard, to be understood, because my angry protector comes out prickly and grumpy, and people don't respond in a helpful way.
Yeah, and just on that too, in terms of some of the settings that you might find an angry protector, like correctional settings or institutional settings, you find that a lot of kind of forensic patients have an angry protector, and they've come from backgrounds perhaps early as childhood where the expression of anger perhaps resulted in punishment, retaliation, etc. And so the only way to kind of connect with anger and express it is in this avoidant way. And that's reinforced in these correctional facilities as well, because if you do express anger, are you going to be aggressive or violent or whatever it may be? And so it's a coping mode that's really reinforced in lots of settings.
Yeah, and I think it can also come out, particularly in couples work. I see it where if somebody's got, say, an emotional deprivation schema, a sense that I'll never really be seen and heard and understood in the way that I need to. If my partner then says, "How are you feeling?" I don't know how to be vulnerable like that. My emotional deprivation gets activated and my anger protector comes out and it's like, "Well, yeah, what do you want to hear it? Do you care?" So I'll kind of push away the very person I want to come close. And therefore, I'm again reinforcing the schema. Or I might feel subjugated. I might have a sort of a schema that tells me if I express myself, I'm going to be punished or I'm going to be shamed. So again, I learn to push away. I learn to be a bit prickly. And therefore, I don't get to express myself. And therefore, this is one of the challenges in working with this mode is we don't want to be put off by the prickliness. We want to actually identify it, notice it in our clients, kind of be curious about it. I'm noticing there's a kind of a side of you that's sort of grumpy with me today, or not happy when I go into that topic. And we need to start to identify when it comes up in order to ask that mode to take a step back.
the question is, whether you're a client or whether you're a therapist, when you are connecting or seeing an angry protector, the question to ask is there something that wants to be expressed right now, but there's a lot of fear around expressing that need? And how do I help the individual, or how do I help myself connect with that need and express that in a healthy way?
Yeah, and I think for people, once you start to get to know your partner, perhaps if they've got an angry protector, or your client who's got an angry protector, when you see it come up, rather than kind of going on the defensive or starting to attack back, you might want to say, are you feeling scared, or is there something going on for you? So asking in that softer way, that gentler way, that really invites that vulnerable side to be expressed, to be heard and have the need met.
And I would imagine, Ruth, in couples work, when you kind of encourage couples to express themselves in that way, I guess the partner probably has some compassion and awareness that perhaps for their partner as a child, when they did express themselves, that perhaps they were invalidated or shamed for expressing themselves and having feelings. So they learned to kind of be angry about that, but couldn't express the anger about that.
Yeah, the history is so helpful for you, for knowing your own reason why you have an angry protector, but for knowing your partner's reason why they have an angry protector. So when we hear that history, it gives us compassion. Maybe we can even be playful at that point. I have certainly couples who are like, oh, porcupines come out. They'll have a little name for it, and it allows them to kind of both lift the mood a little bit and be aware. Same with therapists. We can certainly do a classic bypass that we talk about in our training, how to do that. We can also try to be a little bit playful and start to kind of engage in maybe a slightly different way with the client. Well, that's our 7 minutes, Rita. So for people who'd like to have more information about working with these modes, we cover this in our training, and you're welcome to attend that. For therapists and for clients, perhaps they can be talking to their therapist about their angry protector and why they might have one.